Young people in North America are one of the largest populations disproportionately affected by HIV. According to the Centers for Disease Control and Prevention, between 2006 and 2009, there was an estimated 21% increase in HIV incidence in youth aged 13 to 29. By the end of 2010, and in the United States alone, an estimated 11,731 youth with an AIDS diagnosis died. Due to these alarming statistics, 28 individuals aged 18 to 30 collectively met to discuss how to combat issues related to young people living with and affected by HIV. As a result, a youth manifesto was developed on the following topics: awareness, stigma, healthcare, and research. Now, hear our voices on how we, as young people, can play a role in ending the epidemic.
Young people have the highest rates of new HIV diagnosis in North America.
Part of the problem is that sex education either isn't happening at all or it's not taking into account the voices of young people.
Our skills and our talents are valuable, and our voices need to be heard.
As young people, we have a duty to educate, a duty to advocate, but most importantly, a duty to save our own lives, because as we all know, decisions are made by those who show up.
Remember, we all have a role to play in this society. Let's all be more engaged.
We must advocate for more leadership opportunities within CBOs, ASOs, and health departments beyond entry-level positions.
But we cannot do everything alone. We need you as a peer and ally to be part of our familia to help us achieve a generation that is aware and proactive about their health.
By making young people a part of the conversation, we become stakeholders in our collective efforts to end the epidemic. Nothing about us without us.
Stigma is the fear, shame, and discrimination associated with HIV and AIDS.
Stigma creates real barriers to ending the epidemic.
Young people are more likely to experience multiple marginalized identities. We do not live single-issue lives.
We are young, we are diverse, we are HIV positive and HIV negative. We deserve love and support.
Because of the stigma experienced at these myriad intersectionalities, it's important that older generations advocate, not abdicate.
Youth and stakeholders are often miseducated about the so-called deviant behaviors.
So call out stigma when and where you see it.
Youth do not access healthcare, and when we do, it's inadequate.
Fear.
Judgment.
Religion.
Lenguaje.
Racism.
Homophobia.
Transphobia.
These are a few of the barriers that put us at risk.
What we demand are policies, providers, and systems that work for us and our needs.
What we need to do is hold ourselves accountable,
so that youth can become more proactive in their health.
La única manera que eso puede acontecer es todos juntos.
Everyone is a researcher in some way. If you have a question and seek an answer.
There are young people of color and other communities affected by HIV that are interested in research, yet lack opportunities.
We need research that reflects youth and people of color because it's essential to creating change and pushing our political leaders forward.
Research can be very impactful when it aligns with communities that young people represent.
We need to continue to promote youth leadership and showcase young people already engaged in research.
So, we need you to create, develop, and sustain partnerships to strengthen the diversity within biomedical and behavioral research.